welcome to another episode of Dr. Dallas Unleashed. I am here with Letty. Everybody clap for Letty. And we have a special guest today, Letty. I'm very excited. We have Sarah Shiplett. Am I saying it right?
You are Sarah Shiplett.
Shiplett. And she is the owner and founder of Eira CBD. Am I saying that correctly?
Eira CBD.
And that's spelled E-I-R-A. She's going to talk to us today a little bit about CBD, what it is, how she founded her company and, you know, from the ground up and where she is now, and how maybe CBD can be effective for, so let's say, patients that we have, maybe pre-op for anxiety, post-op for pain and anxiety, and excited to hear about some of those different avenues. She also owns her own yoga studio, Sarah Shiplett Yoga.
Yes,
it's right?
An on-demand yoga studio.
Yeah, that's great. So we're going to hear a little bit about that, but I'm just really excited because, you know, as a plastic surgeon, we see so many people who obviously are having surgeries, and they ask us about, you know, are there any alternatives to, you know, the pain that I know that I'll have after surgery? We use typical things such as pain medications like narcotics. We use like Norco, which is a hydrocodone. We use that in combination of usually an anti-inflammatory like a Tylenol, and then a Valium, which is sort of an anxiolytic, or we call it benzodiazepine. So we kind of have a few things, but people want to know if there's alternatives because they might not want to take those medications. They may have taken it before in the past and didn't have a really good reaction. And so I love to hear about it because I do have people who are on it already and are asking me questions, and sometimes I just don't know how to answer it. So Sarah, excited to have you here. And we just want to hear a little bit about where this started for you. How did this get started, Sarah?
Yeah, well, it's funny that was the segue into it on opioids and just the use of prescription synthetic medication, because in 2019, that was kind of the tipping point for us.
Right.
My husband works in orthopedics. He works with a lot of doctors who prescribe a lot of these medications.
Right.
And people wanted something different, plant-based alternative, and people were vocal about that and asking about that. So in 2019, we set out to develop Eira CBD.
Okay.
So we wanted to help surgeons find a different route for pain relief. That was it.
Right.
And it's here now.
And
so
orthopedic surgeons, they're doing big joint surgeries, and those can also be very painful because bony pain is uncomfortable. It can be just as uncomfortable, if not more, than when we tighten up someone's muscles in a tummy tuck. But absolutely, that's a great place where, you know, orthopedic surgeons are sort of thinking like we do, like, you know, what other options can they use? So
and almost as a first line of defense too, just before you get to even cutting, like what could I use for joint pain, nerve pain, arthritic pain.
Right.
And we found Sacha Inchi seed oil. We mixed it with the CBD, and the anti-inflammatory benefits just are astounding.
What's the seed that you just said?
So Sacha Inchi is our seed oil that we have. We're growing it in the Amazon. So our product is completely grown seed to bottle in Colombia.
Okay, cool.
Okay. We are third-party lab tested in the States, so it's safe, it's legal here. Sacha Inchi is a seed oil with more omegas than any other plant-based oil ever. Okay. So you talk about superfood, and it's Sacha. It's not really well known yet here, but it will be. I promise you it will be. It's kind of like the acai berry was in the early 2000s, I guess, where people didn't even know how to pronounce it. But now you're seeing Sacha kind of like move into the Whole Foods realm, into Sprouts. I had a friend go, hey, I just got Sacha butter at Sprouts, and I thought, that's my CBD oil. You know, so
Sprouts is so great because you can get all those like pre-packaged things where it's like a dry powder, and you get all your vegetables or the acai, and you just put a little water or milk, and I've done that before, and it's really good. You kind of feel like you're doing a good thing. Although I will say, if you do a little bit too much, you're definitely going to have your intestines running pretty good. I've had that issue before, so make sure you take like Metamucil to kind of strengthen things up. But that's so great to hear just about another possible, or it sounds like a superfood.
Superfood. And there's this push for patients or people just in general to kind of take their health into their own hands and to say, what are my options? Specifically, what are my plant-based options? And I love that people are coming to doctors like yourself or surgeons that we work with. So my job right now as a business owner is to educate everybody on the benefits of these wonderful, like, superfoods that we have access to.
Right. So it's Eira CBD. Eira. I'm sorry. Eira.
I know it's kind of funny. We're working on, like, how do we brand that better?
How did you come up with that name? Eira.
It means the goddess of wisdom.
Oh, I like that.
Eira can also mean of the earth.
Did you know that's what we call Letty sometimes too? Yeah. Goddess of wisdom. So then maybe that's a new nickname for you, Eira. We need you to come to the operating room right now. We have another snap to do. So that's neat. So that's where it kind of comes from. And then now you've, you have a little streamline from Colombia. Mm-hmm. Is it actually packaged and put together here in the States or in Colombia?
In Colombia. Everything we see, the whole operation from harvesting the seeds of our plants all the way until when it's bottled.
Okay. So I got a scenario for you. So pretend I am, not pretend, I'm a dude and I want liposuction. And I've heard liposuction is painful. And I want to do something that I can do preoperatively and postoperatively. I come to you. What should I do to prepare myself and use perhaps what you have as an alternative to my pain control and even maybe some of the anxiousness I have before surgery?
So I will go ahead and tell you that I suffer from anxiety. Eira CBD helps me.
Yeah.
It calms me down.
Sure. If you have surgery, then you compound that.
Exactly.
So we see a lot of people who may have that sort of thing. And then you add on top of it this big surgery that you're kind of worried about. And then it kind of goes double time. So perfect. Yeah. So tell us a little bit how I would use it, how you would use it. Yep.
So you can use it 1 to 3 sprays per day. Each spray has 15 milligrams of CBD in it.
Okay.
I will say it is not a one-size-fits-all dosage.
Okay.
You just have to try 1 spray, see how it serves you, bump it up to 2. It is almost like a ritual where you need to experience the product for at least 2 weeks if you're taking it orally, just to maximize the full effect of CBD. If I were to have a headache and I took it, it would work almost immediately for me, like within 30 minutes. Okay. If I'm suffering from anxiety, I would probably need to take it consistently for a couple days or a couple weeks to really notice the benefits. Okay. What we are seeing is people will take it for a couple weeks and then they'll stop taking it and then they'll be like, oh, wow, it was helping.
Right.
Wow, my anxiety's through the roof. What did I change? And most of the time it's because they either stopped or forgot to take it consistently. So that's another part of the education component is just it works if you use it correctly. And there's a huge misunderstanding of how even to use it. So you can sublingual in the mouth.
So it's a spray
It is a spray.
Shoot underneath
and we childproof locked it, which is awesome. Yeah. So it's just a spray. You depress the button and twirl it, and then the hole will open and you just spray it.
And you just kind of aim it sublingual. 2 squirts.
1 to 3.
1 to 3.
Each dose is 15 milligrams. So just to kind of, get that in the headspace.
Okay.
And again, dosage is something that I really encourage everybody to start small, start at 1 and then see.
And would you do that, let's say, in the morning and then in the evening, twice a day?
Yes.
3 times?
I would probably do it, start for once, maybe just in the morning, say you're having crazy anxiety.
Right.
Just take with your morning coffee, take a little spray.
Okay.
If you're having pain, apply topically.
Okay.
Yeah.
And this spray you can apply topically,
yes,
so you just spray it on the skin.
So we have one thing in our product line right now, and this is it.
Okay. So, and what would you recommend? Is it better sublingual? Is it faster?
I believe that it is. For me, it is faster sublingual, and I feel like I get the most benefit from it for anxiety when I ingest it.
I think, and I would agree, anything that you could take orally or sublingually, it's going to get into your system and your venous circulation and arterial system a little bit quicker. Transdermal is much, much slower. But, when we think about pain medications and, if you take something orally, it's going to hit you real quick, but then it's going to kind of fall out of your system a little quicker. If it's through the skin, you're going to get a little bit more of a slower sustained release. And so it won't kind of peak. It's kind of more of a gentle rise or plateau. But I see what you're saying. If you take a little spray once to begin with, and then twice as you kind of get a feel for it, you can start building those levels in your system. So for, let's say, a surgery and kind of get ready for that, I guess I'm thinking maybe a few days before surgery in sort of anticipation.
Yes, of course.
Okay.
And I think that you would see immense benefits to curb that anxiety, especially if you started to couple it with mindful breathing or, some sort of, just meditation to gear them up for a surgery, because it is very scary to weigh those expectations, and you're hopeful for this amazing outcome.
Right.
And it's a lot. And it's a lot up in, that space.
Yeah, because we have people who can't sleep before surgery. And if you can't sleep, if you're already anxious, you become more anxious, and when you're not sleeping, if someone's going to have pain and afterwards, let's say after surgery, they're not sleeping, it makes everything worse. I tell people it's like a volume knob on your stereo. If you're not sleeping, it's like turning your pain up like 3 dials up, because you need that proper rest to sort of, handle the pain that your body's experiencing. And unfortunately, sometimes when you do surgery, you're taking a lot of different medications. On an occasion, some of those medications can make you feel awake. You can't sleep in your normal position, because we're telling, if you had a tummy tuck, you got to sleep flexed. If you're a tummy sleeper, oh my goodness, you can't sleep anymore.
And I had those tubes.
Oh my
on
goodness.
My last surgery, and it was like,
Okay.
So
Sarah had a breast surgery, if you don't mind me saying.
That's totally fine.
So you kind of experienced that. Did you use the Eira?
I did not have this at the time. We were only on the market in Colombia. It was not here yet. We had to go through lots of hoops to get it to the States legally. Yeah. So it was not here. But my partner in Colombia, his wife had a breast surgery, and she used it, and she used no narcotic, no opioids to recover from her breast surgery.
So how would you use Eira for you? If you knew and had this beforehand, how would you have used it for your breast surgery?
I would take 4 to 5 sprays per day leading up.
Okay.
And then I would continue that dosage and apply topically afterwards.
So it's okay to take the spray and apply it topically at the same time?
It is.
Okay. Hopefully that would have helped with, some of that discomfort that you had. The incisions can create some discomfort, but also on the inside, you can experience some pain. So the topical might be very helpful for that sort of skin discomfort, but the oral or sublingual gets in your system and kind of helps you with that sort of overall, deeper pain, as we call it, because sometimes if you put something topically, it's not going to affect the muscle that's real deep as much as we'd like. So that's a great way. I like that.
Yeah. And just talking about pain relief, we have an endocannabinoid system.
Right.
We have CB1, CB2, and we don't have a Tylenol receptor.
Right.
We don't have an opioid receptor. And so to me, grabbing that Aleve if I have a headache, it just doesn't feel as good as grabbing a plant-based alternative.
Yeah. Well, I think it's great to have alternatives, and I'm one of those surgeons who's open to a lot of different things, and I'm certainly okay with people wanting to use that. I think I would probably always give someone the opportunity to have the narcotics on standby, but how I would probably tell somebody or advise them is perhaps to try the Eira CBD. Use that, as we've talked about, topically, also sublingually, a few days before surgery and then into their postoperative period. And then if the discomfort is more than what we think this can do, to use the Norco, to use the Valium, because we don't ever want to leave somebody with so much discomfort that they're not walking and doing those things, because if you're laying in bed, you can have other issues like, we don't want anybody to get fluid in their lungs from laying down, blood clots in their legs from not walking and flexing their muscles. So, but if they're taking less of their narcotics, as you know, that narcotics can make you very constipated.
Yes.
And it slows down your intestines. And I'm assuming that the Eira CBD does not do that.
It does not.
Okay, good.
It does not.
All right. Now, everybody thinks of CBD, they think of marijuana, they think of pot. Is there an active ingredient in your formulation that has I understand the active ingredient is THC, correct?
No,
it's
is not.
In.
No.
Okay.
So the amount of THC in a CBD product is negligible.
Right.
Okay. So that is the stigma. People are like, CBD, THC,
right.
They almost think it's like the same thing because sometimes it comes from the same plant.
Right.
That is not the case with CBD.
Okay.
So I think I read somewhere it's like 14% of the population takes CBD already, adult population. Only 7% talks about it.
Huh.
Because there still is that.
Letty, are you taking it?
No,
she's never mentioned it before, so I'm wondering
I need
if
to
Letty.
try it.
So the biggest question I get is, will it get me high?
Yeah.
And I'm always like a little taken aback by that, because no, of course it won't get you high, but that's what I'm trying to disprove.
Right.
So it's under 0.04 is the legal limit. So you won't get high. There are no psychoactive effects.
Right.
No. So the answer is no, it will not get you high.
Because that's what I was going to ask, because I hear that a lot too. And I know just from research and kind of knowing a little bit about this, that you can't go and take something like this and spray it like 30 times and think, okay, well, I'm going to try to super concentrate what I think might be a little THC. But none of this has the psychoactive ingredient, which is THC. And that's what we test for prior to surgery when we do like a urine test. We're checking for THC. So if someone's taking this, they're not going to show up positive for THC,
no,
are they?
you would not show up positive for THC.
Okay.
The amount is negligible.
Okay. Are there any products out there that supposedly say they have THC, or I don't know, is that something that's out there?
There
not that we're looking, but, because I don't want our patients to feel like they can just go out there and get any sort of CBD thing and not understand that, well, maybe there is enough THC to show up positive in a urine test.
No, but I would say if you don't have a quality product, you might not have much even CBD in the product.
Okay.
So that's, again, going back to a consumer doing their due diligence. Where is this grown? What does the lab report look like?
Right.
What am I ingesting? Because you could pay a premium price for a product that has almost no CBD in it.
Right.
And you're simply paying for like magic snake oil that doesn't do anything.
Yeah.
So I think just having that top of mind, most retailers aren't going to sell stuff here that's not legal. Everybody's pretty buttoned up on that.
Right.
So I don't think that they'll have a problem with getting too much THC. I mean, you could cross the border and go to Oklahoma and just get some, but but yeah.
Yeah, and I'm sure people do that, and we would not advise doing those, whatever it might be, edibles or something that have the psychoactive part, because one, it will, especially if it's inhaled and smoked, it can impair wound healing, and those are issues we don't want to deal with. And that active substance can actually interfere with some of the medications we give during general anesthesia. So an anesthesiologist might see something funny on our monitors, and we don't want to confuse anybody, make them worried that something's going on because maybe you've been doing it and you're worried about telling us. And so, yeah, I think something like this is a really great alternative, and maybe not alternative. You can also use it as complementary to that. I always think about using something like this. So in essence, hopefully you're taking less of the narcotics. You're getting less constipated, and your recovery will go a little bit smoother. So, I don't think of it as an and or, but it could be very complementary to the things that we already give our patients. And maybe the small minority may actually find that's all they really need.
I absolutely love that.
Yeah.
I just love that. Just calming the nervous system is important to me as a yoga teacher, and somebody who prides herself on teaching meditation and mindfulness, and how can we stop holding that tiger on a leash, whether it's before surgery or whatever we're dealing with. I think that's phenomenal to just have it as like another tool.
Yeah, perfect. Well, how do we get Eira CBD if a patient or myself or Letty wants to go and get it? How do we do that?
We have an e-commerce site that we can, I can give you the link to.
Yeah.
We're also looking for retail partners if you're interested in something like that. We work with a lot of orthopedic surgeons in the area. We haven't ever worked with a plastic surgeon, which is really exciting to me, because I think that it wasn't anything I foresaw.
Right.
Just in that market, I was thinking like big joints, hips and knees.
Yeah.
I wasn't thinking, tummy tuck, breast reconstruction, that kind of stuff. But
Right.
that's very exciting to me to see that in the future, and I think that's the way it's headed.
Yeah,
for sure.
And that web link, that's a place where you just go to the website.
EiraCBD.com.
Okay.
Mm-hmm.
Yeah, and then from there we can purchase it, and probably different, formulations, not formulations, but volumes.
So right now we just have the one product in our line. We have beauty oils coming soon, which I'm really stoked about, because once I started taking Eira, I noticed my skin started glowing. Okay. It was the craziest thing. I was like, that's interesting. And it was like, I noticed a decrease in inflammation. I noticed like the dryness kind of went away. And I was like, there's something to this. We need to research this. So right now I'm product testing different Amazonian seed oils. You should see my bedroom. It's just like I got all these like bottles, and but we're product testing that now. So that'll be coming soon. But right now, it's just one product, because we polished it really well, and it's a phenomenal product.
Yeah, and it looks like it's plant-based, so people who might be vegan are worried about putting something in their body that isn't vegan-friendly. Plant-based sounds like vegan-friendly.
It is vegan-friendly, 100%.
I used to be a vegan, but now I'm just a vegetarian. Kind of boring. I think vegan sounds so much cooler. I lost all my vegan superpowers, so but that's okay. This is really exciting, and so I'm really interested to see how some of our patients might do on it. So thank you so much, Sarah, for coming on and explaining a little bit about your Eira CBD and what it can do, the potential benefits for our patients. You said your husband works in the orthopedic field, and I'm sure they're seeing results as well. So I think there's a lot of great stuff to come with what you have here. So thank you for getting that together.
Thank you guys for having me.
You also have a yoga studio fitness. I'd love to maybe one day have you come back to talk to us a little bit about some of the mindful meditation and wellness, because, as a plastic surgery, facility, we are working a lot with what people's physical, appearances, and that's sort of how they perceive themselves. But I think, this feeling comfortable in their own skin, which I think, the mindful meditation can really help calm what's going on in the inside, would be a wonderful thing to let people know about and to do in combination with, if they're thinking about, surgery, to also know that, it's not just about the outside, but the inside needs to go along with what you're doing on the outside. So tell us a little bit about the yoga real quick, if you want to plug that.
Yeah, I've been teaching yoga and meditation for about 10 years now, and it's always been a passion project of mine, and I taught mostly at small boutique fitness places. I did teach at Lifetime, a big box gym, for a little bit.
Okay.
And then COVID hit, and I didn't know if it was safe to teach in a studio. I just, there was so much we didn't know, and I shifted the entire business online. So I opened up a concierge studio, and we did small pop-ups and events, and then we had an on-demand studio.
Cool.
Lots of corporate yoga came my way when COVID hit, because of what you said. People are looking for healing. They're looking for mind-body connection. They're looking for a way to kind of take their own pulse on the daily. And so little yoga snippets, like 5 to 10 minute meditations, do really well right now, just like those little resets during the day. Also mindful movement, very accessible flows that you can get into. You don't need a lot of space for it. You don't ever have to know Sanskrit. But I try to make yoga very accessible to everybody, because I truly believe it's a modality that everybody needs. And,
awesome.
And right now, it's very accepting to try new things, especially yoga, meditation, even, simple mindfulness activities like mindful walking or, mindful eating, stuff like that.
Very cool. Well, thank you so much. A pleasure having you, and love to maybe down the road hear a little bit more about that stuff, because we could all use it.
Yeah,
but Letty, did you learn a lot here?
I think so. I'm ready to try some.
You want to try some? She's got some little samples here.
Yeah, so I have some. So we don't use additives. So
don't spray it in your eye. It's sublingual and not up the nose or an ear. But thank you so much.
Yeah.
We're excited to try that.
And get back to you.
Yes. So I think we'll wrap it up here.
Yeah.
That was a good one. What do you think, Letty?
Yeah, I liked it.
Yeah. So, but until next time, you're always welcome back. But Letty, you want to sign off for us?
That is it for Dr. Dallas.
We'll see you guys
Bye,
next
guys.
on the next episode of Dr. Unleashed. Bye.
Thank you.